Hello angels, how are we doing? Welcome to my channel. This is Evangel Anyanwu. I am a Nigerian trained medical practitioner living and working here in the Kingdom of Saudi Arabia. Yes, in case you're seeing me for the first time, thank you for clicking on this video. I don't know your reason. Whatever is your reason, please stay tuned and watch to the end. And then if you like the information I'm going to be releasing in this video, give me a very fast thumbs up. And if it applies to you, just think about it the second time. I want you to watch this video with an open mind. I don't want you to be biased about it, and I have my reason for trying to make this video, for wanting to make this video. And disclaimer, I am not a plastic surgeon, and whatever I'm going to say here is based on my experience with some patients that have gone through this, just a few of them, and then others who have been sending me messages and then inquiring about this particular procedure I'm going to talk about. And it is the BBL, that is Brazilian butt lift. Whether it originated from Brazil, but it is called Brazilian butt lift, and this is like an operation that is done to enhance the body. Yes, if you agree with me, whether you like it or not, at some point in time in your life you have wished probably you have the Kim kind of body figure. Yes, I do fascinate about it. Sometimes I fantasize about it too. But the thing is this: whether you fantasize about it or it is your reality, or you want to go for this operation, I want you to watch this video and watch to the end so that you will have an informed you will make an informed decision. You will not just go into it without knowing what you're going into. Is it okay to go for such a surgery? It is your personal decision. I am not here to tell you to go for it or not to go for it, and I'm not here to tell you that it is the best or it is not the best for you. Hello. So I am only here because some people contacted me and asked me about it. Yes, I have answered them in my inbox. I have responded to their queries, but I feel I should do more so that people, the larger audience, will hear me out and then make an informed decision. So the thing is this: for some years now, this particular surgery or this particular operation we're talking about has really gained popularity. It's so popular, even maybe secondary school girls are actually talking about it. Hello. Yes, it is very popular now, and the reason is not far-fetched. It is because of the social media influencing that it got. I am not even surprised that some procedures are done live. People come on live on Instagram to watch these procedures, and people do them and post them online for people to see what is happening during the procedure. I am here to tell you what is it and what is involved and how it's been gaining popularity and what is going to happen during, maybe before, during, and after the surgery. The much we know. This is on a more serious note, a very new concept, a very new surgical procedure. So much is not really known about the after effect, about the long-term effects of this particular surgery. What is this Brazilian butt lift? It is just like you getting a fat grafting. We call it fat grafting. The fats you have in your body, most people want the fat to be taken away from their lower abdomen and their lower back and giving them that snatchy look, the Kim kind of look. Fat is being taken away from all these places. The places you don't want it, and it is placed in the right places, in the place you want it. That is your backside, your butt, or whatever you may want to call it. The process of taking the fat from your lower abdomen or your underarm or your lower back is called liposuction, like sucking out the fat. But now a suction is used to do the process, and when this fat is taken away from these places you don't want it, it is now injected into the right places. That is your butt, your lower thigh, your thigh, and then your hip, just to give you that rounded, hourglass shape. Now, why are people going into this? Sometimes it might be fantasy, sometimes it might be some people's reality. A lot of people go into this without even knowing what happens before, during and after this particular procedure. And some people are well informed. If you're well informed, kudos to you. And if you're not properly informed and then you go into this and you start seeing the whole thing and it looks like, I mean, the whole earth is crashing on you, I'm sorry about that. It is very necessary that you look at things properly before you go for them. All that glitters is not gold, but all gold definitely will glitter. Hello. The procedure is really a very meticulous one. It is not everybody that can do it. I'm really surprised that I could see somebody who said, I'm a cosmetology and I'm doing BBL. Oh my gosh. Well, it depends on your level of training. If you're well trained in it and you have the license for it. In medicine, there's what we call privileges. If you have the privilege to do something, it must be documented. And if you go to somebody who does not have the privilege to do this particular procedure and there is a problem, you are just Oyo. So the most important thing before you even plan on going for this particular procedure, please make sure you do your due diligence. Please make sure you do your research. Know where to go to, know whom to go to. Now, there are some complications associated with this particular procedure. Likewise, every other surgery or every other operation, there is inherent complications, and then there might be complications that are due to the human resource. There might be complications that are due to the environment. Then there are complications that come with every surgery, whether the person knows his onion or her onion or not. Hello, can somebody hear me? So that is it. This particular procedure, is not an exception. This particular procedure is not an exception. So there are inherent risk or complications that might come with this surgery. So before you go for it, make sure you do your research and know where to go to, whom to go to. Can somebody hear me? Just type in the comment section if you are really following what I'm saying. This particular procedure, because of how social media has influenced the popularity, a lot of people just go to just anywhere, anyhow to get this procedure done. Why do you want to put your life at risk just for something I don't know how long it's going to last? Because nobody knows. Probably less than 5 years, probably less than 10 years. Nobody has told us what happens after 20 years, you know. Of people go to different countries to get this procedure done, especially where it is cheap. Because the reason I'm even doing this is because somebody walked up to me and then told me she wanted to get this and that she is leaving her country where health is of utmost importance and going to a particular country, I'm not going to mention the name of the country, to go get this done because it is cheap there. How can you do such? Who does that? Don't mind that I'm laughing. It's a very serious issue, very important to me. I don't care if you want to get it. I am not judgmental. I am not going to live your life with you, and the benefits and the disadvantages, I'm not going to share them with you, but I'm trying to tell you to get you informed on what might happen. What about the cost? Yes, we talk about BBL. What is the cost? The cost to some people might be $3,000 to up to $30,000. Yes, especially for those who do it at the low cost. Oh my gosh, I don't know what to say. But then doing it at a higher cost does not guarantee that it will be risk-free. So before you go to that place they will come out money for you, think well, think again. Who is a candidate for this particular procedure? Anybody could be a candidate as long as your mind is in it, as long as that is what you want. But there are certain persons who might not qualify to be candidates to this particular procedure, especially those who have other comorbidities. Before you even think about it, before you even say I want to do this, get yourself checked medically. Get yourself checked, do all your routines, and be sure you are fit for this. Now, I was watching a particular program on Facebook and I heard a woman crying that her daughter died from this particular procedure. And some of the things she said in that interview really shocked me, because She said the daughter booked appointments with a particular person in another country where it is done at a cheaper rate, and this particular daughter of hers never saw the doctor who was going to perform the surgery. She was just talking to the nurse assistant all through the time she was making her bookings, and she actually went for this surgery and never saw the doctor until the time of the surgery. Who does that? This is a very risky operation. This is a very risky procedure. So how can you go into it without meeting your doctor one-on-one, talking about your health issues if you've got one, talking about the risk involved, talking about the complications, so that you will make an informed decision, an informed consent for this particular procedure? How can you do that to yourself? I'm not telling you not to get it, but before you do that, make sure you go through the right path to get everything done before that particular procedure. It is a very, very, very dangerous operation. It is very dangerous. So before you go for it, make sure you do your due diligence. Make sure you get yourself checked. Make sure you're talking with the right person. Am I communicating? Please tell me your take on this. Will you want to go for this? Will you advise your girlfriend or your wife to go for this? Will you encourage your sister or your mom or whoever to go for this particular procedure? Let me hear what you have to say in the comment section. Talking about the procedure, it is just the removal of fat tissues or fat cells from the places you don't really need them, like the lower abdomen, like I said, the lower back, sometimes under the arm, and then injecting it superficially. I mean, it is really injected in the subcutaneous space, not in the muscle, not below the muscle, above the muscle. But the problem is sometimes these fats might just slip into the muscle or into the vessel and cause a lot of harm. The major complication, the major risk that people are afraid of is the fat embolism, because the person can just die. If you are a doctor, you will agree with me that pulmonary embolism or fat embolism, whatever embolism you may be thinking of, kills like this. Bam, bam. It might not be treatable, might not be reversible, and the person just dies like that. Now, the painful part of this thing is, this is now my take, it is young healthy adults, young healthy females that go for this procedure. It is not really those who are sick. You may say, okay, oh, they died as a result of sickness, oh, this surgery was carried out to help them because of the disease that are passing through or that are going through, so this operation was done to help them. These are healthy, vibrant young women in their 20s, in their 30s, and some in their 40s. So you just lose somebody like that, and the mortality rate is high, guys. It is high. Yes, it keeps reducing though, but it is still high. 1 in 3,000 women who will go for this surgery will definitely. A lot of people may think that after going for this surgery, it is the end. What about recovery? When you go for any surgery, there is always a post-op protocol. There's always a post-op process. There's always a post-op instructions that will be given to you. For this particular set of people who go for this BBL, believe me, it is not an easy one. I don't know how you're going to do it. Not to lie on your back, not to lie on your side, not to sit for a particular duration of time. I don't know how you're going, how they are doing it, but whoever that have done this, kudos to you. You are really the strong woman. I'm not, because I can't go through that. I cannot just wrap my head around not sleeping on my back, because I sleep anyhow, of course. When you go for this surgery, you'll be told how not to sleep, when not to sit. Of course, your health should be up there. Your health should be up there, just to reduce the rate of risk or complications that might come from it. And then you will definitely have to do some massages, some exercise to keep fit. So it is not just about, yes, oh, I have gotten my BBL, I have my body snatched, I am now looking like Kim. What about the after operation events? Definitely they will come. How you manage it determines the outcome as well. I'm going to be talking about some of the complications of this particular operation, and I'm going to be going about it from the small to the bigger ones, or in no particular order. Now, this operation has got some complications, and if you did your due diligence, if you did your research before going for yours, definitely your doctor will tell you. But if you went for those who will probably not even consult with you, not even see you until the time of the operation, I'm sorry, you might not have the opportunity to discuss all these complications with your doctor. The first one I'm going to talk about is the seroma. Seroma is like a fluid collection. Number one, when this fat is harvested, it is with time, of course, there are fat cells, there will be fluid collection, because sometimes when the fat is being harvested, you might just alter some tiny vessels here and there, might be lymphatics and all that. So definitely there will be fluid collection. That's called the seroma. So people will feel so, they will feel that they are accumulating fluid, and this is really one of the least, because it could be taken care of if it doesn't resolve on its own. Cellulitis is infection that involves the skin, and it's most times superficial, yes. And cellulitis, of course, it is still another, maybe minor, but for some people it might be major. Depends on your body system. Abscess, that is the infection that goes deeper than the cellulitis. For abscess, it is not just about giving you antibiotics, oral antibiotics. There might be some sort of drainage, because you have to drain the pus for the person to have some relief, and the person might be running fever, the person might just be feeling so weak and feeling really sick. So that is another complication that might come from it. These are not really specific to this particular surgery. These are, in every surgery there's risk of infection. That's one thing you should understand. So this is not an exception. There might be fat necrosis. Yes, there might be fat necrosis. And this is one thing that a lot of people experience. They will say, oh, there is one lump in my butt. Oh, one is bigger than one. Oh, there's something that feels like a stone in my butt. Oh, there is this, there is that. Yes, a lot of people complain about this, and the truth is that it could be deep and it could be superficial. People always worry about the superficial one, because that's the one they will feel, that's the one they will see and all that. Remember that when this fat is being harvested and injected into your body, not all of them are going to survive. So some people will say 70 to 80% or 90% of the fat that's grafted, is called fat grafting, that is injected into your body, will definitely survive, and the rest, either your body will reabsorb them, or they will die off and then form the necrosis. The necrosis just means death, cellular death. So when you have such, that is one of the complications. A lot of people may have it for some time, 6 months, some will have it even for months, weeks to months, and your doctor may not really do anything at that point. They want to wait and see how it goes. Sometimes it may resolve on its own. Sometimes people may do home remedy to get it resolved. One is the obenge complication, which is the fat embolism I have talked about before. If this fat that is being injected into your body is mistakenly or anyhow injected into the vessels, of course they're going to travel. They're going to travel, and they might be stuck in your heart or in the person's lungs, and then they will cause pulmonary embolism or ischemia or whatever, and then the person goes. So that is it. Now, what happens if, let's say, you did it, you never had any complication and all that? What is the aftermath effect? What is the effect of having that scurvy? Of course, the amount or the quantity of fat that is extracted or that is harvested and then injected or grafted into the butt might be so enormous that if you gain weight, it will expand, and if you lose weight, it will shrink. So bear that in mind. We don't really know what will happen 20 years later, but remember, you're very young, your ligaments are very still young, very intact, your skin is very elastic. But what happens when you're like 40, when you're like 50, 60, 70, that the skin starts, the butt going to just overlap the thighs or the leg? we don't really know what will happen. So before you go for this particular operation or for this particular procedure, think of what you will look like when it is like 60, 70. Yes, we will say we don't really care about how we look like when it comes to that particular age, but believe you me, at 40 you will say, oh, I don't care what I look like at 50. When you get to 50, you will definitely care about how you look like. With the social media environment we're having now, with what is happening on the internet, believe me, you will care about how you look like. But is it a good thing? Does the shape really look good? Yes, it does look good. It does look good. I will not withhold that. It does look good. When I see people who are well snatched with like the hourglass, like the Kim kind of shape, I admire such. But will I have the heart to go for such a procedure, to get such, I mean, not just adding too much. I already have some here, but you know, just adding a little back there. I don't think I have that kind of liver. So will you be able to do such? Let me hear you in the comment section. Tell me if you can do such, if you can go for such surgery. That is the BBL, Brazilian butt lift. Will you be able to go for that? Now, before I conclude, guys, if you have not subscribed, please make sure you subscribe. Share this video. Let people get to know about this before they run into trouble, so that even if they decide to go for it, they will make an informed decision. Apart from the operation or the surgery, can somebody actually look like the hourglass without going for surgery? Yes, there are other means. People, I mean, are getting those kind of, you know, Kim kind of figure or body transformation. Some people do that in the gym, which I am #1 lazy person who I'm so lazy when it comes to going to gym. Yes, I'm very lazy when it comes to going for exercise. But people have achieved such shape or such body figure with exercise. Some people use some kind of equipment to rub on the place, massage it several times, and then there is a significant change there. But this Brazilian butt lift surgery, it is just bim, and then the shape just comes. I think that is the reason why people go for it more than choosing the long-term exercise or the or the other ones. So what do you think? Will you advise your wife or your daughter or your girlfriend or your sister to go for it? If they tell you, bro, sis, I want to go for it, what will be your advice? Like I said, for everything in life, there is advantage and there is disadvantage. So what are the disadvantages of this? If there is any complication, of course, you have to go through it by yourself and for yourself. But what is the advantage? Of course, when you bring all those nice images on Instagram, we get to click the like for you and sometimes comment fire, you know. That is the advantage. Once you take any picture, we will definitely have to comment on your status, this is hot, you know. I mean, at that particular time, you're gratified. At that particular time, you feel you are on top of the world. Who doesn't want to feel so? Who doesn't want to feel like they are at the moment? Is it only girls that are going for this particular surgery, Brazilian butt lift? No, guys are already going for it. They just want to add a little patch at that side too. Their reason, I don't know. I come in peace. But the thing is that this particular surgery, on a more serious note right now, this particular surgery has so many risks inherent to it, complications inherent to it. We're not talking about the malpractice, that is the complication that may result as a result of errors from the operator or the surgeon. Infection and other stuff comes in, and there might be a complication as a result of the drugs that are being used for the anesthesia and all that. So before you go into this, please be informed and stay safe, live a healthy life irrespective of whatever choice you make. I'll see you in my next. If you have not subscribed, please do so. If you have not liked, please like, share, let more people hear about it. Today I've responded to those people, but I think more people should hear about this, and that is the reason I'm doing this video. I love you as always, angels. Take care of yourself and peace. I'll see you in my next. Bye.